Hello, my name is Rebecca Johnson. I grew up in Little Rock, Arkansas, and I am a registered nurse that works for Medical City McKinney in McKinney, Texas. When I come in the morning, usually report starts about 6:45. We do a bedside shift report, and we go to each bedside and introduce ourselves to our patients. And we figure out what the plan is for the day and any problems or anything they've had throughout the night. And after I've gone through each of my patients, usually it's anywhere from 4 to 6 patients. One of the things we have in nursing is if it wasn't charted, it wasn't done. So we could be running around all day and taking care of patients and actually doing what we're supposed to do. But if we don't document it in their medical record, it literally wasn't done. So we can be tied up and stuff for a while, actually doing patient care and doing other things and tasks and problem solving. But at the end of the day, we've got to make sure that everything is actually documented. So I try to be timely as far as my management and everything, and I make little notes and stuff so that way if I do get a chance to sit down, I can chart probably the last 6 hours in a good 15 minutes if I'm just left alone. But I like to talk a lot, so I have to manage that too as far as my talking to my coworkers. I remember when I was in high school, my dad would ask me, what would you like to do when you grow up? Just spitballing, trying to pick my brain. And, would you like to be a nurse? And I was like, I don't want to be a nurse. I actually did decide to be a nurse when my sister got in a car accident. She broke her pelvis in 4 places, and she was convalescing for several months with physical therapy and traction and all the things that her recovery entitled and everything. But I realized taking care of her, seeing her nurses and the impact she made, I was thinking, I can do this for somebody, and I wanted to do that. And I told my sister, I think I want to be a nurse. And she was really funny, oh, I'm so glad I had to break my pelvis in order for you to figure out what you wanted to do. But, I had taken a couple years in college and stuff and just, didn't really know what I was going to do. So it was nice that I actually had a plan after that. And so that's why she kind of gave me a little grief over that. One of the things with nursing is you have to establish trust and rapport really quickly. And, you're in with a person who's in an intimate part of their life. And I like to kind of just diffuse that and tell them initially, I'm going to take care of you like I would my sister. And now that could be good or bad, depending on if you ask my sister, the bossy Becca. But I really do. I feel like it alleviates a lot of the concern, and I know that it's coming from a genuine place because I really do love what I do. Even on the craziest day, I wouldn't trade being a nurse for anything. I figured that was the most cost-effective way, and it was close to home. And then I actually signed on to a program that allowed me to work for the hospital once I graduated if I signed on, to work for them. And of course, that made us hustle when we're all seniors because there's a lot of us graduating, and a lot of us did that. So we interviewed with different departments and things. And I can remember my first interview was with CCU, which is a critical coronary unit. And in the interview, literally, she said, "So how do you handle death and dying?" And it was stunned. And I just could sit there and just smile thinking, who have I even known that has died? And it was been a great grandfather or something, And I said, I don't. We didn't have a lot of resources as far as extracurricular stuff, as far as health science classes and things. But we did have sports. And I feel like sports has really helped me in my profession. Not only is team building and everything, but also knowing what your strengths are. And that everybody plays a role. And sometimes, I might be the lead on one day, and some day next might be my cohort and stuff. But playing up to your strengths and knowing that you're part of a bigger purpose has really been beneficial to me in my professional career. Don't be afraid to get an education. My dad was very wise. We didn't grow up with money, and I knew that I'd have to take out student loans in order to get an education. And of course, I was 18, graduated. I didn't want to have any debt or anything like that. And he was so wise in telling me, and I'm so thankful that I listened, that you can pay off a car, you can pay off a house, but you can never pay off ignorance. And that was the best thing I ever did. And to be able to do what you love and actually make an impact in someone's life, it's priceless. So it was totally worth that.